Hi, good morning. My name is Diana Bianco, and I'm a consultant with Artemis Consulting. Welcome to the panel on a regional approach to health equity. I'm a health policy consultant based in Portland, Oregon, and I've had the privilege of working with Washington's 9 accountable communities of health for the past 2 years. With me today to talk about the ACHs are Peggy Maguire, who's the SVP of Corporate Social Responsibility and Palliative Care at Cambia Health Solutions, as well as the president of the Cambia Health Foundation. And I also have as a guest Liz Baxter, who's CEO of North Sound ACH. I want to remind panelists, and we've posted this, that if you have questions during the panel, to please post it. That's attendees, not panelists, but attendees, to please post it. And if you have if there's a question that you really want to be asked, give it a thumbs up and it'll rise to the top. We just have about 25 minutes here to learn about some of the unique approaches of the ACHs, as well as Cambia's commitment to the work of the ACHs. It's been a difficult year. I think maybe we're seeing light at the end of a very long tunnel. And in this session, we hope that there's some hope in the conversation we're going to have, because you're going to hear about the role of Washington's ACHs in improving health in the state, about Cambia's commitment to those community-driven solutions to vexing challenges, and some opportunities for 2021 as we look to the future. So that's what we're going to talk about. Again, if you have questions, please post them, and we'll just get started. So Liz, I'm going to start with you. And I'd like you to take a couple of minutes to describe the role of ACHs in their endeavor to improve health in the state and what makes them unique.
Great. Thanks, Diana. And I just have to start by saying I'm really grateful to be having this conversation with Peggy, just in gratitude for your leadership over so many years of my career. So about Washington's ACHs, there are 9 of them. The state's divided into 9 regions. They first began forming in 2014 with a focus on community and population health. While the geography and demographics vary a lot from region to region, there are some things that all of the regions hold in common, and I wanted to just kind of highlight those things. First, we are governed regionally. And so each of the 9 regions has a board of directors. It's filled with local leaders and stakeholders who know the regions and are charged with making decisions for that ACH based on the needs that are known in each of our regions. So it makes us really closer to the ground in understanding and prioritizing needs and what some of our strategies are. All of the ACHs have been working with both clinical and community-based organizations in behavioral health and physical health integration, addressing the opioid crisis and chronic disease management, things that we know are really heavily impacting the health of people and the healthcare systems across the state. All 9 of the regions are emphasizing equity. And several of us are using targeted universalism as a frame to actually determine our strategies. And for those who don't know it, targeted universalism is an approach where you actually come to an agreement on universal goals, and you recognize and commit that there will need to be different strategies for different subpopulations in order to reach those goals. But your one agreement, you will find a way for everyone to reach the goals that you've set out. And the 9 ACHs are also working together. So we are each independent of each other, but we collaborate a lot. We are collaborating to find as many ways as possible to define some common solutions that can be carried out consistently statewide. And the and is probably pretty important, and allowing some space where differences across the state, where there's regional variation, actually enhances our ability for regions to be successful. So in some ways, it's kind of targeted universalism at the ACH level. There are just some things that might work in Seattle that might not work in Wenatchee. But most often, if something actually works in Wenatchee, it'll work anywhere else in the state. And so really trying to be thoughtful about how we get to the statewide-ness and things that happen in different ways across the state. Probably in closing that, our interventions are really matched to the diversity of the communities in each of our region, decided by leaders in our region. And we're trying to demonstrate that there's creativity and innovation that actually happens a lot in rural areas where they're so used to having fewer resources available. But some of the really most creative things that are happening outside of the urban areas. So we're really excited about that.
Liz, thank you so much for that sort of summary of what ACHs are and what they're doing. Peggy, Cambia just made a significant investment in ACHs. Can you talk about that and what was behind the decision to invest in the ACHs?
Yeah, well, thank you for moderating this conversation and bringing Liz and I together to talk about this work and this investment. We view philanthropy as a catalyst to transform healthcare. And what we're basically trying to do with our corporate philanthropy is to foster a healthcare system where everyone has access to what is needed to live their healthiest lives. And as we all know, the pandemic has magnified the gaps and inequities in our healthcare systems. But one of our core beliefs is that these disparities are not inevitable, but they're a symptom of a broken healthcare system. So as we look to change the system, we're looking for partners who can help us address these gaps and inequities at a systems level. And that's really where we think the Washington Accountable Communities of Health come in. Our $2.9 million investment in the state of Washington is part of a regional investment of $11.5 million in 17 different organizations across Oregon, Washington, Idaho, and Utah. These organizations are working to reduce the stigma and inequalities that surround mental health access and well-being, especially in rural communities. So we're hoping that our funding will increase access to behavioral health services with a focus on crisis support, building capacity through established community organizations like the ACHs, and then also reduce the stigma for people of seeking help. One thing I've noticed about all of our partner organizations, all 17 of them, have a really good understanding of the strengths and the needs in their respective communities. They listen to the people that they serve and they engage the community to reflect solutions. So as I think about, our $2.9 million investment in Washington and the ACHs, I think that ACHs are great partners because they build trusting relationships that help drive community-led transformation. They use data, in my opinion, effectively use data and efficiently use limited resources while maintaining a commitment to equity and working really across the network to achieve equitable outcomes. I think it's Liz, I really love the term that you used about targeted universalism, to really look at what is needed in a particular region, but then to draw on the strength of the network as a whole to drive transformational change across the state of Washington. I think, we're hoping that this investment will help Washingtonians recover, rebuild, and then ultimately become resilient coming out of this pandemic. That's the bottom line.
Great, Peggy. Thank you so much. I want to build on a little bit of what you said and ask the two of you to share some thoughts about, you both mentioned equity. And, we've all known for a long time that there are health inequities. And COVID-19 has exacerbated and really highlighted and laid those bare. I'd love to hear from both of you about your thoughts about what ACHs can do or continue doing as we move towards recovery this year. And Liz, I'll start with you. I'm particularly interested, there was also conversation, or Peggy mentioned this multi-sector approach and, the community voice. And I'm particularly interested in, if you want to talk about some of the work that North Sound has done, a couple of the projects to bring to life the sort of work that ACHs do, focused on equity, focused on this multi-sector approach, focused on lifting up and listening to community voice about what the needs are in the region. So let's start with you, if you want to just talk a little bit about that and share some examples, and then Peggy would love to hear your perspective as well.
Yeah. And just know that if I give examples from North Sound is not alone. I mean, I really think that all 9 of the ACHs have been stepping into dialogues around advancing equity and addressing systemic and structural racism, just in different ways. We all have different starting points, matching the challenges and the assets that we have in each of our regions. Several of us, including North Sound, have actually built some expectations into contracts with our partners around them engaging internally and with each other on what we refer to as a tribal and equity learning journey, understanding some of those strengths and assets across the region, learning ways to work with the tribes, which many organizations have not done historically in the state. And, so those things are just incredibly important. And again, I think just recognizing that there's no, and I'm going to use air quotes, there's no right way to do this, but what an amazing opportunity that the state of Washington has in having these 9 different regions, because we can actually demonstrate varied approaches to equity and race in ways that reflect the varied voices and experiences that exist across the state. So we're all committed to equity. And, but that means being unsettling at times, exposing contradictions in policy, talking about inconsistencies along with the inequities and disparities, and trying to find some strategies about how to address that.
Thanks.
If you want me to keep going, just nod and I'll keep going.
Peggy, both from a Cambia perspective, a philanthropic perspective, and sort of this interest in the community voice, in addressing inequities, in sort of this multi-sector approach to transforming the health system. Can you just talk a little bit about that from your perspective, and both from a philanthropic perspective, but also about what you see as the promise for ACHs, especially in terms of recovery in 2021?
Yeah, thank you for the question. Prior to the pandemic, we had invested about $15 million philanthropically to address health equity and try to create the system that would allow all people, to have access to what they need to live their healthiest lives. I think as a result of those investments, when we learned about COVID, we anticipated that the fallout of the pandemic would disproportionately impact some communities. And we think the ACH system here in Washington is really well positioned to lead the community-led change. I think there's some aspects of their work that we were particularly excited about. One is building that health system capacity by addressing regional workforce needs, by listening, by learning, and then doing what's necessary to create kind of cohesive practices, thinking about telemedicine practices, carrying forward what we've learned in the pandemic into the future, and then thinking about advancing equity. The other aspect of the approach that we really like is this transforming the care delivery system so that we're supporting more integrated models of physical behavior and behavioral health that really create whole person care as the standard of care, both in the state of Washington, but then also as an example of what can be done in other parts of the country and ultimately nationally. I think addressing, all of the influences that impact a person's health, that whole person care approach, is one of the ways that we can begin to address health equity. So I also like the, again, I said this before, but the 9 regions that are trying unique approaches in their particular community and their geography, but then also learning from each other about what works and how to spread that models that work.
Thanks so much for that, Peggy. And let me just sort of piggyback on that, because having worked with the 9 ACHs for the last 2 years and watched them, not only, as Liz has said, where can we collaborate, but also where can we learn from each other? Understanding that our regions are different and we have different needs and different community sort of challenges in front of us, opportunities and challenges, but where can we learn from each other? So really appreciate that, that it's not, there are 9 individual ACHs, and there's also a collaborative of ACHs that are trying to together address some of those issues, whether it be integration, which we know, having been in healthcare for many years, we all know that is one of the great challenges, one of the great needs. How do we address whole person care? And the other thing about the investment that Cambia has made in behavior, it's in behavioral health, and we all know from this pandemic that those needs have skyrocketed. And then this other issue that I think both of you have lifted up in terms of the needs of rural communities that, again, that have been highlighted, and whether they be sort of groups of sort of people of color or rural communities, or that tribal partners where there are deep inequities that we see. So what are the opportunities for ACHs to address those, listening to their communities? What are the ACHs and what have they already been doing? Because they've been doing this work for years, and this has just created more opportunity there.
You're absolutely right that our investment is really targeted at behavioral health needs in rural communities, because that is one of the gaps we've observed in our healthcare system. The other critical part of what you said is there's an old saying that Liz knows I've probably spoken about a lot, is, don't do anything about me without me. So don't have the arrogance to think you know what's best for a community, particularly as a funder. Right, we're not going to come in and write a check and then tell you exactly what you need to do with that money. We're going to listen to you and partner with you and listen to the needs of the community and the solutions that are emerging from community dialogue in order to create lasting and meaningful change.
So we have a couple of questions in the chat, and I'm going to see if we have time for both. I'm not sure, but let me take this one about sort of examples of how ACHs have used their unique position to leverage change in persistent health inequities, and sort of what are markers of progress. And I think as we know, sort of measuring those disparities and inequities are important, and it can be challenging at times. Liz, I wonder if you could just weigh in on this a bit. We know that a number of ACHs across the state have been working really hard on addressing health inequities, both by lifting up that community voice, by doing specific things with their investments, with their dollars, by creating partnerships. Liz, I'm just going to give you the opportunity to share, to weigh in on this, and then also how to, sort of partnerships with the state and with MCOs, and how do we do this together? Go ahead, Liz.
Yeah, it's kind of, I'm going to try and summarize this in like a minute and a half, which could take me an hour. I think we look at equity from our board leadership perspective, from what our team is doing, who we contract with, what we expect of them, how we disperse dollars, who are we investing in. And then we have things that come to us where, probably the first example that comes to mind is in relation to COVID. We have this nationwide, be physically distant, wear a mask, at a time when you couldn't find a mask in a store if you like had $1 million. And then you've got essential workers. And for us in the summer, that was our field and farm workers who had no ability to physically distance, who had no access to protective gear. And we had community organizations reaching out to us and saying, can you help us protect field and farm workers? And, we realized that how we define essential workers expanded. It isn't that the essential workers that we were all calling heroes weren't heroes, but our essential workers that included the field and farm workers, people who were working in grocery stores, home and healthcare workers who could not sustain their own families and income by being physically distant. And we have seniors and people with disabilities who are counting on somebody to show up at their door every day. And so we found ourselves, even around COVID response and PPE distribution, pointing our direction towards those who we knew were left out of the common kind of circles of who we needed to get resources to. We were starting where we knew communities were telling us they were left out of some of those distribution strategies. And it has meant that we see organizations who were all volunteer organizations 2 or 3 years ago now being staffed, now being able to actually support their organization in different ways. We have both in some of our tribal partners and with communities serving people of color, we have just been investing in their ability to become influencers, decision makers, potentially competitors to us, in terms of seeking dollars, because it's that important to focus our direction there.
And I also just want to add that, and I'm going to put this in the chat, that there's more information on what different ACHs have done as well on the website, which is washingtonach.org. And I just put that in the chat so folks can check that out, because there is information there too, because there's so many different ways to get at this. And I want to just highlight, and then go to Peggy for another question. I want to just highlight that the ACH has been really involved in addressing the pandemic, and especially listening to those voices for folks who are secretly impacted by it. And so whether it's been the distribution of PPE, which they've been really involved in their communities, whether it's that or whether it's making like emergency investments to address those most impacted by the pandemic. So there's been just a whole host of work, and there's more information about that on the website. So Peggy, wondering if you have some additional thoughts you wanna share as we move towards wrapping this up, or just on this idea that you've mentioned on the whole ACHs in recovery and resilience.
I think this is not to pontificate, but because I think Liz knows all of this, but I think if I were to say 3 things, it's like use data to identify the gaps and really be clear about what the gaps are and what problems we're trying to solve. Then listen to community voices to develop solutions, and then measure the impact of those solutions and adjust if they're not getting the results that we intended. See how we can adjust those solutions to, really create the impact that we intended. I think these are all things that the ACHs are doing, and we're really looking forward to working with you and partnering with you on progress over the next year, because I think it will be there, and I think it will help Washingtonians emerge from this pandemic in a much more resilient way. I mean, you mentioned hope at the beginning of this session, Diana, and I really have a lot of hope that by working together, we will emerge stronger. We won't go back to the way things were, but we're going to come out with something better.
Thank you so much, Peggy. Liz, I want to give you a moment to share some closing thoughts, and then I'll wrap us up.
Yeah, probably the one thing that I would add, and I'm thinking about Better Health Together, over in the Spokane area, that has been focused on broadband. And so when I think of equity, health systems, COVID recovery, who would have imagined broadband was going to become a health and an equity and an economic issue? It is whether it's making the difference about whether your kids can stay in school, whether you can access telehealth resources, whether you actually have the ability to work remotely, even if your business says you can work remotely. All of a sudden, we have like this massive issue that all of the ACHs, have been stepping into, because it is either going to allow communities to recover or they're going to be more behind than they were before. And, I just think there are things that are emerging that the ACHs are, not necessarily always like the experts, but we're the conduits, and I think as Peggy has said, to people who actually can make decisions and tell us what's needed in their communities. And that's been a pretty exciting thing to be a part of.
Thank you so much. And I just want to highlight that as we wrap up, and I apologize that I didn't get to both questions. We ran a little bit short on time. It sounds like, this rural piece, I do want to lift up that the rural piece is really important. And we'll take that question and sort of ponder it and think about it. And just know that there are the ACHs are there as trusted community partners. There's more information on all of the ACHs on their individual websites, as well as the website I posted. Cambia's made a statement with their investment about what's important, focusing on regional needs, focusing on community, and we hope that you will join Cambia and the ACHs. And if you don't know about your ACH, go learn about your ACH to help Washingtonians recover and prosper and demonstrate resilience coming out of what's been a very difficult year. I want to thank Peggy and Liz for participating today, as well as all of you for attending. Really appreciate it, and enjoy the rest of the conference. Thanks so much, everybody.
Thank you.
Great.
Bye-bye.
Thanks.